Welcome, everybody. My name is Dr. Kyle Stanley. I am the Chief Clinical Officer of a company called Pearl. We are an artificial intelligence company, and I am in my relaxed Friday flower shirt. So I hope you guys are having a relaxed Friday as well. Today, I'm going to talk about artificial intelligence in dentistry. You know, there's a lot of misconception around this topic, and I'm really on the forefront of this technology. So wanted to give you guys an insight into what's coming, what's here, where I think the future is going. I'm a private practitioner in Beverly Hills, California, and I'm also one of the co-founders of Pearl. So if you guys have any questions, please just save them to the end. After I give my presentation, then we can have a question and answer session. You know, I can show you guys some demos of things if you want. So we'll be totally interactive towards the end. And the overview for today is that I'm going to give you an overview of AI in general. You know, just that you kind of know what this is. You can talk to your friends at the coffee shop about it. We'll go into AI in healthcare, AI in dentistry. And then we're going to talk about why AI. Do we even need this? I mean, we've been doing dentistry for so long. My dad practiced dentistry for 44 years without AI. Why do we need AI now? And then we're going to talk about putting it to work and what it can really do, and especially how it benefits group practices. So I think today will be insightful for many of you. So what is this revolutionary technology that you may have heard of, right? Everyone's talking about AI. I mean, it's all over the news. Every little thing has to do with AI now. What is it? You know, I got into AI about 5 years ago. I didn't know what it was. And I love this quote from Asimov. And Asimov has all these laws about robots. And he says, a robot may not injure a human or allow a human to come to harm. And I think this is the idea that's seen in the general public. It's the idea that, you know, this robot has been sent from the future to kill you, and that the AI that won't open the pod bay doors. That sci-fi AI is called artificial general intelligence. That's computer intelligence that is more or less indistinguishable from human intelligence. That AI does not and may never exist. And it's not what we're talking about today. The AI that you hear about today is not really at all human-like, but it's inhumanity that makes it so useful. So the AI that we're talking about today is called narrow AI. It's narrowly focused. It's really, really good at just one subject. So a narrow AI could identify the model year of any Porsche based on the taillights alone, for example. But I can also do that. I can play tic-tac-toe, I can fry an egg, I can do a cartwheel, I can play with my son. All of those things that I can do, that takes general intelligence. You see, the AI that could recognize those Porsches by the taillights, it could do that really, really well, but that's it. It's only good at performing one highly specific task, but it's really, really good at that. And oftentimes, at least a lot faster than us. And that's what makes it so useful. When you're talking about something at scale, like for example, with rock, you know, you guys have hundreds of thousands of images. For me to go through and look through hundreds of thousands of images, I mean, it would take me years and I wouldn't be able to remember everything. But the AI can go through all those images, you know, in a matter of minutes and remember everything that it remembered. That's what makes it so useful to us. Okay, so these narrowly focused AIs, they're trustworthy. Okay, so they're not these machines that have been sent to the future. And they're trustworthy precisely because they don't have the general intelligence that allows our attentions to be divided. The AI we see today is simple and honest, and that's why we're putting so much trust in it. We're passing off busy work like dictation and scheduling and sorting and labeling and route planning. So many of the things that consumed about 30% of our workday, we can pass that off, and AI is giving us that time back. It's allowing us to do more of the things that take that real human intelligence and do them better. So for example, in dentistry, it can do things like auto charting for you, or it can help you with probing depths, or it can read the radiograph for you and give you an idea of maybe what this patient may need for treatment. That allows you to focus on the clinical aspect a little bit more. And AI feels like it's something new. However, it's really been around since the 1950s. And AI is really an umbrella term. It covers a huge range of machine systems that can perform tasks that have traditionally required human cognition. So as early as the 1950s, a group of researchers realized that a binary system could be programmed to simulate any process of formal reasoning. So binary means like zeros and ones, yes or no. And their research led to a subfield of AI called machine learning. And this uses training data to recognize patterns in the data and make decisions without a human. So it's narrow, it's precise, and it's learning a very specific task. But it wasn't until the 1990s that machine learning really started to show promise. And that was because of an approach called deep learning. So deep learning is where the nodes are organized similar to that of a human brain. So it's like we're trying to recreate a human brain, but only to do one specific task. And so deep learning systems mimic how our brains work. But it wasn't until, about 10 years ago that this technology really started to take off. And that's because for AI, you need three basic elements to have what's called deep learning. You need data-driven algorithms, which we had, although what we didn't have until recently was processing power and big data. So processing power, you may have heard of Moore's law, where processing speed doubles every 18 months. This is why your computers get faster and faster, your phones get faster and faster, and maybe even more expensive. All of the technology, if you buy a phone today, in 2 years, it's a dinosaur because the processing power has doubled by then. And then big data. If you tried to do something in the 1970s, nothing was digitized. I mean, think about if you tried to do AI in dentistry, even in the 90s. Not a lot of people were using digital radiographs. There was no intraoral scans. Everybody was charting on paper. Now, in the last 10 years, I think the big thing with dentistry has been the digital workflow, digitizing everything in your practice, intraoral scans, face scans, CT scans, digital radiographs, digital charting. That now we have all this big data, we have the processing power, and we have the algorithms. We can then start looking through this data and trying to find these patterns that make it so easy for us. And AI is all around us. You interact with it every day, and you may not even know it. In the new iPhone, when you pull up a picture, or when you go to take a picture, it takes, I forget if it's 8 or 10 pictures before you take your first picture. So it then takes the best pixels from those images to give you the best photo. And that's why the camera has increased so much, is largely because of the AI, taking a composite of 8 to 10 photos and giving you the best pixels. And, we interact with these 3 different types of AI every day. Predictive and analytics is one that I interact with all the time. This is what, why my Netflix screen looks like it does, why my Amazon screen looks like it does. When I get an alert from my bank that tells me, let's say I bought something big that I usually wouldn't buy, It's making a prediction of what I'm going to buy and what I usually spend, and give me that alert if there's something out of the ordinary. And I think one of the biggest ones that I use, is getting in my car, going to work, or going to the grocery store, is navigation. That's predictive analytics. That's predicting where the traffic was for the last, however many years, taking those little data bites, now predicting what's the best way for me to get to work or to get, to wherever I'm going. And then you have natural language processing. This was, I think, one of the first ones that everyone thought was really cool, right? I remember when Siri came out and it's like, whoa, you can talk to it, and Alexa and Google Home. And now you can just say, Alexa, turn on Justin Bieber in the living room, and the music comes on. And then at the top, you have computer vision. And computer vision is what I'm most interested in, and a lot of what we do at Pearl. So if you think of natural language processing as allowing the computer to listen and understand, computer vision is allowing the computer to see and understand what's in the image. Okay, so you hold up your screen on one of your apps, and it recognizes where your face is so that it can shoot a rainbow out of your mouth. But it's also used in surveillance. It's also used in autonomous vehicles to look at an image and understand what's happening in that image. And this is such a powerful technology that, of course, medicine took note. And you can see here that medicine has been used in breast cancer, brain tumors, wrist fractures, even in COVID, at chest x-rays, analyzing people for COVID. And when you look at some of the data here from some of these two articles, 5% more true positive diagnoses. That means people who actually have breast cancer are being found 5% more. A big one here, 11% fewer false positives. Imagine being a woman that is told you have breast cancer, you get a mastectomy, or you have all the surgery, you do chemo, and then they realize it was a false positive, you actually didn't have it. 32 times faster treatment. That's pretty amazing. 96% diagnostic accuracy. So healthcare took notice and started doing this. And what's interesting is I think that what makes dentistry so unique is actually what makes dentistry a more fertile ground for AI to plant its roots and start delivering fruit. And that is because we have relatively lower stakes. We're not finding cancer. It's not life or death. I've been practicing for 11 years out of dental school, and I've seen cancer once or twice, maybe. We're not doing fractures and brain tumors. We're doing caries and bone loss and calculus and periapical radiolucencies, and people can live without their teeth. We also have less politics. We're not dealing with hospitals. Many of us aren't dealing with government programs. So how a lot of technology gets implemented in dentistry is an owner doctor or an owner of a group goes in and says, yeah, I want to use that technology, bring it in. And that's about it. We're dealing with a single biological region. We don't have to think about, oh, let's do AI for the brain and the foot and the chest and whatever it is. We're dealing with the mouth. And then we also have this increased rate of practice consolidation, a group practice like Rock. If you have one person that's making the decision for however many offices, that makes it much easier to implement that immediately instead of 50 different owner doctors having to make that decision. So I think this really makes dentistry ripe for AI to come in and really do great things very quickly. And when you think of AI in medicine, I think you think of diagnostics. I'm a private practitioner like many of you. And when you look at this image, this is kind of what everybody is talking about, right? In this image, we're seeing existing restorations, fillings, crowns. We're not seeing root canals, but you can see root canals. We're also seeing caries, calculus, bone loss. You can see periapical radiolucencies, wide and periodontal ligaments. So most of the pathologies and existing restorations that we'd be looking for every day are already detectable by the AI to a level that is, as good as a human. And it's not only being used in diagnostics, but it's also being used in the restoration process. So when you take a scan, if you have one of the newer intraoral scanners, as you're scanning, if your finger gets in there, it'll remove your finger. Or if the cheek or the tongue gets in there, it automatically removes it. So it's already making things easier for us. With margin marking, we have a product with that we use artificial intelligence to mark the margin. We have clients who are labs that see thousands of scans a day from dentists all over the country or all over the world. And they have like an army of people that sit around on a CAD drawing going click, 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 and marking that margin. Now, the AI can do it to the same accuracy and do it much faster and much cheaper. So what you can do is take those people off of that and put them on something that really requires that general intelligence that we talked about. Staining and glazing, right? The artistic aspect. Maybe, recontouring a restoration, or adding little mamelons or stains, or, gingival staining, something like this. That's where we really need our human, artistic, general intelligence. In design, it has been used for the last few years in design. When you think of things like CEREC or 3Shape, designing a restoration that matches that area, is good occlusion, good contact. And then the last one, the last one is quality control. Being able to see when you prep a tooth and you take a scan, the AI can tell you, hey, this margin is pretty good. We give you a good score on this. Or, you know what, we're missing this area on the margin. Can you repack cord and just take an impression real quick, or take a new scan? So it creates less remakes, less chair time, better communication, more consistent treatment for our patients. You guys have probably seen the robotic surgery, and I think this is really a cool innovation for the future. It makes things more precise, more consistent. Now, I place implants. You may say like, well, do we need this, right? I could place implants freehand, but I choose to place implants with fully guided surgery. Why? Because it's more precise, because it's more consistent. I have a higher quality of care. I have less risk. I like to be risk averse if possible, especially practicing in Beverly Hills. So, the innovations that come, it's not like we can't do it without it. It's that we can be more efficient with it. I like to relate it to, intelligent cruise control that a lot of new cars have. It keeps you at the correct distance from the car in front of you, behind you. It'll stop for you if you're not looking, but you still have the wheel. You can always override. You're in charge. It's just there as an assistive tool. And that's how AI and robotics and all of this comes, is it's an assistive tool for the doctor, for the team. I don't know if you guys saw this video in Asia where they placed the implant with a robot. It was funny that the headline is like, implant placed with no doctor, and there's 20 doctors standing around. I just thought that was kind of funny. So why AI? Like I said, I can place implants without guided surgery or without robotics. We can read x-rays without AI. It's really, AI is flashy, it's cool, it sounds really great. But after all these years, and many of you have been practicing for decades, I'm sure, every dentist thinks they're pretty good. I mean, if you ask me, are you a good dentist? I'd say, yeah. You ask my dad, he'd say, yeah, I think I'm pretty good. You ask my brother, he'd say, yeah, I think I'm pretty good. We all think we're doing the correct diagnosis. We're very consistent. Well, it turns out that we're actually not. I'm sure you guys have heard about this Reader's Digest study that was done, I think in the 90s, where an investigative journalist went to 50 different offices with their own mouth and radiographs, and got 50 different diagnoses and treatment plans. And that's difficult for a patient to understand, right? There should only be one diagnosis, first of all. There can be a few different treatments based on that, based on training or philosophies. But to get all these different diagnoses, that's really hard for our patients to understand. Why, if they go to me, I may say they have, 2 fillings, and they go to my dad and he may say they have 5 fillings. That's just really hard. And then it creates distrust with our patients, which isn't good for our profession. So these are a few studies. On the one on the right, we did with Pearl. And what we did with that one is we asked 3 doctors, well-trained dentists, to look at about 9,000 images and identify if there's caries in the image. And what we found was that there was only 4.3% of the images where all 3 agreed that there were caries, which is relatively low. You had one doctor who saw caries, everywhere. You had another doctor who barely saw it. You had another doctor who kind of was in the middle. And that's what you see when you start looking at a lot of these studies on consistency in dentistry. The other study on the left we did with the Dental AI Council, which is a nonprofit that we helped to found. And we took an FMX and we let 136 doctors diagnose and treatment plan for that patient. And it wasn't very consistent. we got treatment plans from $300 to $36,000. And imagine being that patient. Imagine going to one doctor and saying, it's $300, this is what you have to do. Probably, 2 fillings or something. $36,000, okay, we're gonna do endo and crowns and extractions and implants. And both these doctors think they're right. What do we do with that? We need something that helps us create a standard of care that keeps us more consistent. When you look on tooth number 3 from this study, 51% of the doctors said, no, there's no caries. 49% said, yeah, there's caries. I mean, it's like a toss-up. You can flip a coin, is there caries or not? And that is so difficult for our patients to understand. And this type of inconsistency with us doctors is because we're human. It's very difficult as a human to be very consistent with something, even if it's something we're highly trained in. And this is why insurance carriers have they were one of the first adopters to AI in their business. So how insurance carriers are using AI is that they're reading radiographs, with our technology, and then using it to approve your claim faster. So for example, if you send in a claim for scaling and root planning, they're going to look in the radiograph using our AI and find if there's bone loss in calculus. If there's bone loss in calculus, then they automatically approve it. So that is good for really everybody. Us doctors, we get paid faster. The patients can get treatment faster, don't have to wait, 6 weeks, whatever it is, before something gets approved. And then for the insurance carriers, they can save money on their overhead. From utilization review, this is where I think it's really interesting. So what we're doing is using artificial intelligence, computer vision, to find fraud, waste, and abuse that's being sent to insurance companies. So if you look at this image on the left with the blue circle, and this was sent in saying the patient needs a root canal. Okay, so some human examiner looked at this and said, okay, it looks like there's big filling, maybe some caries on the distal. Okay, now they did the root canal, and then they sent back the image with the orange on it. And I looked at this image and said, okay, it looks like, pretty good root canal. I don't do root canals anymore, but pretty good root canal, nicely packed, got a percha, goes all the way to the apex. Yeah, pretty good root canal. So of course the human examiner approved it. But what the AI found was that this was actually the same image that had been photoshopped. And this had been paid for. So the root canal was never done on this patient. Every dentist that I've met is a good person, is an honest person, is trying to do their best. They're trying to support their family, further their career. Although we do have these bad apples in our profession that give us a bad name, right? Whenever something bad on the news happens with a dentist, they always put it all over the news, and it makes all of us look bad. And so with this product, specifically for insurance companies, I said, I want to find these bad dentists because I don't want them giving us good dentists a bad name anymore. They're defrauding the insurance companies, and none of us really like the insurance companies. But when you think of the insurance companies, a lot of them are government funded, meaning that us as consumers are paying for this with our taxes. So all of this fraud that's happening is coming from us, really. So this distrust with our patients creates a problem. And it's been studied many times. People trust us dentists less than they trust medical doctors or less than they trust airline pilots. And that isn't rooted in the fact that they're reading these studies on inconsistency. No, they see it firsthand. Like I said, they go to me, I say they have 3 cavities. They go to my brother, he says they have 4. They go to my dad, he says they have none. Who are they supposed to agree with, even in the same family? And you see on the right, we did some studies where 82% of patients would prefer that their dentist use the most advanced AI diagnostic technology available. And when you look at the AI's impact in the clinical aspect, it's really these three words that make it better for patient care. So how we train our models, which is to help address this consistency issue. So if the AI gets something right today, it's not going to get it wrong on that same image tomorrow. But the human may. I miss my cup of coffee, I get it wrong. I get my cup of coffee, I may get it right. I have an argument with my wife, I may get it wrong. I don't have an argument with my wife, I may get it right. It's as accurate as a highly trained dentist, but what makes it so useful is that it's more consistent. And that consistency is important because it undergirds patient trust. As dentists, we're always able to make the final call, but it may be showing us that little calculus on the mesial number 19, or that open margin on the distal of the premolar, whatever it may be. We don't need to blame anybody for us being inconsistent. We're human. It happens to all of us. And if you don't think you're inconsistent, maybe you haven't been practicing long enough. We all make mistakes. It happens. And again, it's like that intelligent cruise control. You're still in charge of the car, you still have control, but it's there to avoid you from problems, and it's there to make you drive better. The AI is here to be an assistive tool to make you more consistent, help you build trust with your patients, and help them have better health. If you show an image to a patient, it's a weird black and white image, you say, here, there's caries here, I think you have caries, we need to do a filling. They're like, okay, I don't know what that is. But if you can show them an AI image and say, not only do I think you have caries, but a third-party artificial intelligence that's trained by thousands of doctors around the world also agrees, it's a built-in second opinion. When I first got into AI, I thought that so much of the impact of AI was going to be clinical. And what I didn't realize is how much AI is impacting practice management. So, we're in the business of delivering care, right? And in my practice, I can do the best care possible, the best treatment, guided surgery, using rubber dam, whatever it is that I think is a high standard. But unless I have my patients coming back, unless I have new patients coming in, unless I'm understanding my limits and my abilities, I'm not going to have a business. I'm sure you guys have friends who are amazing dentists that are terrible business people. And that's how many of us are. And that's really why, the group practice world really happened, because a lot of us dentists just want to practice dentistry. But we need to keep that business happening. So these clinical benefits deliver tremendous benefits to practice managers or owners, in that you have less remakes, higher standard of care, you're reducing your risk. We don't like to admit that we make mistakes because it's shameful and really it's costly. When our care is better, our entire business performs better, and all of us make more money. When you think of an example of, you take an intraoral scan, or you take a traditional impression, let's say, and there's one area on the margin that the tissue went over, you didn't retract the tissue well enough. You send it to the lab makes a crown, they send it back, you bring the patient back in, you try it in, oh, the margin's open, or there's overhang, whatever it is. Okay, now you got to get the patient numb again, you got to take a new impression, you got to send it back. That is a practice killer, because you've now lost money on that crown, if you have to try it in twice. So all of these little aspects where we can get some assistance, it makes us better from a business standpoint as well. And of course, less stress. I'm a big proponent of mental health in dentistry. And one of the reasons why I like incorporating AI is the mental health increase that we have. There's so many of us dentists are stressed. We're dealing with so many things, ordering, and we're talking to our team members, and we're trying to make money, we're trying to pay off our student loans. And when I can reduce my decision fatigue by having AI make some of those decisions, and I can focus more on clinical dentistry. That's what I love, right? I love clinical dentistry, and that's what I can focus on. So how do we put AI to work? The way AI's impact is on clinical care is affecting practice management. Everything that happens in a single practice really gets amplified in a group practice. So, if I have a single practice and I have some problems, if I have 50 practices, those problems get amplified 50 times. So it really has a profound effect for group practices. And this is where I think there's 5 benefits for DSOs that are using this type of technology. One would be quality control. Us as dentists, we go in and we need to do things to a certain quality, but because we're human, we kind of do this. So if you bring in AI, it allows us to be more consistent. Process automation. This goes back to what I was talking about with reducing decision fatigue, right? If we can allow the AI to, help us with our probing depths or auto chart, or even just tell us, hey, the patient's probing depths are out of date, make sure you do it. Just that little thing is one less thing we have to think of and we have to worry about. Office administration. This is probably one of the biggest things I've seen in recent, even just months with some of our products, is how it can impact office administration. A lot of our products, the doctors don't even have to interact with, or the hygienists don't have to interact with. It can all be done with the team members. And how much more involved the team members can get to create more production and better care for our doctors, keeping the chairs filled with high value patients is so important to us doctors, as many of us are paid on percentage of production, or a daily rate plus percentage of production. In marketing, we don't like to think about marketing because we're in the business of delivering care, but we need to market to our existing patients and our new patients in order to keep our business going. AI allows you to go through the radiographs and find specific patients to market to based on data that's in their radiographs. So if you're doing an implant special, let's say, you don't send it to every patient, because, if I'm a patient, someone send me implant special, I'm like, I don't have any missing teeth. I don't have any hopeless teeth. But if you're a patient with edentulous regions or hopeless teeth, perhaps, you can specifically send them marketing pieces like that. And the last part is acquisition. As you know, many DSOs are acquiring new offices quicker and quicker. When I bought my practice, we went in and did like a 10 chart audit, right? We looked at 10 charts. Okay, yeah, pretty good. All right, let's see, was the patient happy? We looked at a few preps. I mean, it's pretty crazy to think that, you know, you go in spending so much money only looking at 10 charts. Now with AI, what you can do is go in and say, was there any fraud happening? Did they recently raise their fees? Is there any dentistry left to do? You know, I have friends who bought practices and then they go in there and everything's done. No one has anything to do. Everything was just recently done, like the last 2 years, and there's no dentistry. So it can allow people that are acquiring practices to go in and really get a deep dive into what's happening with their practices. So practice intelligence is one of our products that I think is really great that I use in my practice. So I encourage you guys to see a demo. I can show you something today if you guys want to see something, but basically what this does is it takes all of the radiographs and analyzes the radiographs for the last 2 years. So it's looking for patients that are active patients. And then it cross-references that with what is seen in the practice management system. So for example, if you have a patient that is being seen for prophy, but practice intelligence finds that there's bone loss in calculus. And it's also going to see if they've had scaling root planing in the last 2 years. If they haven't, then it'll show up in a funnel that your front office manager or, you know, your treatment coordinator can look through. And then when that patient comes in, what they can say to you right before you walk in, or they can put it on, you know, on your practice management system is, hey doc, take a look at this patient. You know, he or she may be a candidate for scaling root planing. I just wanted to get your opinion. You can go in and say yes or no. Again, it's ultimately up to you, but it's like a little parrot on your shoulder that can show you things that, you know, you may have missed or may have overlooked. It's just like, you know, this happens in my practice. I'm about to go see a patient. Let's say I'm about to do, I don't know, an implant on number 12. But before I go in, my team will come to me and say, okay, we're going to see Mrs. Jones. You're doing the implant on number 12. Can you just check the mesial of 19? I think there may be little caries started. I'm thinking like, wow, okay, that's pretty cool. And what it is they were looking on practice intelligence, saw caries that the AI had found, and then they're bringing it up to me. Like I said, I can say, no, that's not caries, that's cervical burnout, or, you know, whatever. Or I can say, oh yeah, that is caries. Hey, Mrs. Jones, let's do this filling before we do your implant, and, you know, we'll do them both while you're here the same day. And now, you know, you can turn a $4,000 day into a $6,000 day, or $6,000 day into a $10,000 day, or whatever it may be. Because a lot of the patients that are already coming into our practice have other treatment that we may be missing out on. And so one of the other ways that I think it's really cool is that for our front office managers, or, you know, front office staff, when they have to do recall, let's say they're trying to fill a schedule for, you know, 2 months out or something. They're trying to fill a perio schedule and they have 100 people on their list. All these people are due for recall. Who should they call first? Now, usually you just start at the top, right? Start with A. What AI can do is organize those patients into a specific order that shows the patients that need the most care. And what the most care means is they're the most valuable patients for them. So we want to call the patients and get them in if they have unscheduled treatment, but also that if they have unscheduled treatment and they have some AI findings that weren't in the practice management system, let's get those patients in the chair. And then while they're there, we can check the detections and see if the doctor agrees with them. If so, we can try to do same-day dentistry. And so by doing better clinical care, we can get better financial outcomes, and we can really get an instant return on our investment. You know, I think AI, I'm really passionate about AI, and I think that it is one of the big futures of dentistry. Like I said, I'm really into implant dentistry, and, you know, I see a time when there's like a one-click treatment planning on a crown or implant dentistry. You take a CT scan, you take an intraoral scan, You put them into the AI finds where the edentulous region is, it finds the type of bone that the patient has, where the sinus is, where the tooth should be, it designs the tooth. It automatically designs the guide, goes into robotics, the robot places the implant, you come in, place the crown on it. I think that it's going to limit a lot of the annoying, repetitive, day-to-day tasks that we have to do every day, and will allow us to focus on what we love to do. And I think with many of us, that is clinical dentistry. So if you guys have questions, you can contact us.